Hello, my name is Frank Garza, and I'm a back pain specialist with Pure Physical Therapy in McAllen, Texas. Now, today's video is going to speak, or I'm going to talk about the three common causes of back pain or sciatica. A few months ago, we had a seminar where I presented on this topic, me and a couple of other therapists, and we went over the three common causes, how to find it, how to figure out if you or somebody you know is one that can associate with those causes, and then of course provide the best physical therapy intervention or treatment for that cause to better assist with the pain. So without moving along any further, let me introduce you first to the first cause, and that is a herniated disc. Okay. Now, you may ask, how do I know if I have a herniated disc? Well, some people get it through imaging or an MRI. But some of the symptoms that are associated with that of a herniated disc is pain or tingling or numbness or weakness down the leg. Now, most people that have this problem will be very specific with their pain symptoms. They'll say it starts in the low back area and then it travels down the leg, either above the knee, or it could possibly go into the foot and toes. Now, how does this happen? How does one get a herniated disc? Well, it happens a lot of the times in younger individuals that are either have participated in some sort of traumatic event or have been involved in a motor vehicle accident. So usually trauma and younger individuals. However, repetitive bending can also compromise the disc and lead one to have disc problems. My dad actually had a herniated disc issue not too long ago. He happened to be picking up pecans from a very large pecan tree at home and was repetitive bending, for over about a span of an hour. The next day he couldn't get out of bed. So what happens when some of us do repetitive bending or what have you? And in order for us to understand that, I drew a little model here per se of what happens when we get a herniated disc, so that we understand a little bit of why we have those symptoms. So as you can see here, this is a bone segment and this is another bone segment. Okay, this is what we call our L4 and our L5 segment in our spine. Now, this view here is as if you were looking at somebody, facing in this direction. So their tummy would be out here, and the spine or your spinous processes are on this side. And what happens in every level of the spine, all the way up into our neck area, is we have this vertebral body here and this one here, and in between we have what we call our disc. And our disc is supposed to be situated with this nucleus in the middle. But with a lot of repetitive bending or maybe heavy lifting or traumatic events that we talked about, this disc will bulge out in this area here posteriorly, okay, towards the back. And when that happens, it provides or adds pressure to the nerve roots exiting each segment, okay? And that's important because those nerve roots come out of your spinal cord through there, and any compression on that spinal cord or that nerve root can cause pain down your leg because it's attached to a certain segment in your leg, and it's responsible for controlling that segment in your leg. So it's very typical, very common for somebody to say, well, I have pain in my toes. Why is it my back problem? Well, if it's a disc issue, then it very well can be the cause, because this disc is impinging or putting pressure on this nerve root, which then exits and facilitates that part of the leg. So again, with herniated disc issues, just to recap, it's mostly in younger individuals that have been involved with a lot of trauma, or maybe have lifted something way too heavy, or again, a lot of repetitive forward bending, which causes the nucleus or the disc to bulge or herniate towards the back, adding pressure on those nerve roots exiting that segment, causing pain, tingling, numbness, or even weakness down your leg. So a lot of times, you'll see or will see typically in the clinic somebody with this condition and they'll say that sitting, increased sitting hurts, or long periods of sitting, but that standing relieves their pain. Okay, because sitting will do this and add increased pressure on the disc, causing pressure on the nerve. But standing or extension position, typically a lot of times they'll say that this position feels better, which makes sense because if you go into the opposite direction, extension, then the nucleus or the dynamics of this disc is said to move forward more to where it's supposed to be, hence decreasing pressure on that nerve and decreasing your pain. So if you or somebody feel like you have pain with bending and it's relieved with extension, you may have back pain caused by a herniated disc, and definitely we can help you with that. And we'll get along to what you can do here in a little bit as we go through the rest of the conditions. Now, a little research on herniated discs and MRIs before I get into the second condition is asymptomatic, or people without pain in the low back or the legs may also have a herniated disc show up on an MRI as a person that does have pain and has pain down the leg. So a question that I usually get in the clinic is, can a herniated disc heal? And the answer is yes. With time and with the proper exercise, we can heal a herniated disc. So, though there's studies shown in evidence that some of our colleagues have done in the past that, they'll have a person with a herniated disc show up in an MRI and it's in the findings, and then after weeks of physical therapy treatment, the proper treatment approach, they'll have another MRI that later on that year, or 6 months, 12 months down the road, and it has shown that the herniation has resolved or has healed. So yes, a disc can be healed, but I want you to understand that about just because you have a herniated disc on an MRI does not necessarily mean that is the cause of your back pain. So we need to, when that's the case, we need to find a therapist that will further evaluate you and look at your MRI findings to tell you if that's truly the cause of your back pain. Okay, so moving on to number 2. So second most common cause of low back pain or sciatica is, so the second most common cause of low back pain or sciatica is arthritis, okay, degenerative disc disease, or stenosis. And all these three are classified in the same category because they all do the same thing. So if we break these up individually, let's talk about arthritis first. So arthritis is basically the inflammation of a joint. Okay, so if, for instance, you had severe arthritis in your vertebrae, that means that this segment here, the borders of your joint, it'll be inflamed, so it'll be thicker. As you can see, if that happens, then if the space where a nerve root is supposed to exit out of is being thickened by more bone formation or inflammation of that bone, then that space is going to be narrowed or closed off. And if that happens, the same thing can happen as pain in the low back that may or may not radiate down the leg. A lot of the times it may be both legs that are involved. It may be one-sided as well. But what we do know is that the functions that relieve this pain is opposite than the disc herniation. So forward bending will most likely help this person, whereas extension will most likely provocate or increase your symptoms. Okay? So degenerative disc disease, what that is over time, as we get older, we shrink as we get older, and the reason for that is because our discs, once we stand up and increase pressure through our disc will lose water and they'll dehydrate. So as they dehydrate, this space here is now decreased. Okay, and if this space is decreased, then this space is going to be decreased, and so on and so forth, and everything's going to be compromised. Okay, and the other thing is stenosis, or narrowing of our lumbar foramen, which are the ones on the outsides, or the one in the middle where our spinal cord goes through. So before we get into what these are, I want you to basically know who this person is or who this person presents like. Anybody with arthritis, degenerative disc disease, or stenosis is going to have pain with standing or walking, long periods of standing, anything that involves this motion, and is going to be relieved with bending, okay, or slouching forward. For instance, if you go to the grocery store, I'm sure you've seen someone maybe pushing a cart and maybe bending a little bit forward. That person most likely is suffering from one of these three conditions, because that position is actually relieving their symptoms or giving them some relief. So again, two very common causes of back pain: one, arthritis, degenerative disc disease, or stenosis, which we just talked about, and the other, herniated disc. Herniated disc, it will provocate, or symptoms will increase with forward bending and decrease with extension or lumbar extension. Whereas stenosis is the exact opposite. It'll increase the pain with these motions, but yet it'll decrease the pain with these motions. So very important in your care to know what exactly is causing the back pain, because if they don't evaluate this thoroughly, they may be doing McKenzie extension exercises when you have this condition, and it could actually further provocate or make the condition worse. So this is cause number 2. Arthritis, degenerative disc disease, and stenosis. All right, so cause number 3 of common causes of low back pain or sciatica is SI joint dysfunction. Now, we feel as physical therapists that this is the most commonly missed reason of why somebody has low back pain or sciatica. If somebody comes to me and they say they've tried chiropractic work, say they've tried massage therapy, say they've tried exercise, they've tried aquatic therapy, they've tried manipulations, they've tried yoga, they've tried Pilates, they've tried everything in the books to heal their back pain, and nothing's gotten better, that's a hint to me that I'm going to evaluate the SI joint. Okay, so just before we get into why that is and some of how somebody would present with that, I'm going to kind of give you a little drawing or a model per se of how you could understand it. Okay, so this should look like your L5, which is your last lumbar vertebrae, okay, and then you have your sacrum and your coccyx, okay. So this segment right here and this junction here, where this bone and this vertebrae come together, okay, this is your sacroiliac joint. Now, if I were to come up to the top of this segment and just how this is, drawn out, and move this top block out of the way, you would kind of see that moving the top one out of the way is not really going to do anything to the bottom 3. However, if you move this one in such a way where it's rotated to the right, or maybe shifted to the left, or maybe it's too deep in on the top bone there, then everything you do to this segment is going to directly affect everything above it. Okay, so this is your SI joint. Now, a lot of the times, people that may have SI problems, they'll be able to point exactly where that pain is, and most likely it's going to be right here. Okay, and when it radiates, it may radiate down to the outside of the thigh, maybe anterior thigh, maybe inner thigh, But different from herniated disc, they won't say it travels exactly all the way down the leg. They won't be able to pinpoint it exactly. So the pain is a little bit more global. They may have a limp in their walk. So when they walk, you may see like a hike in their hip. So it's called the Trendelenburg gait pattern. That may be present as well. But a lot of times we can get this through history. Okay, so a lot of the people that come in with low back pain that fall under this category are a lot of the times mostly women. And the reason for that is because of the makeup of the female pelvis in comparison to the male pelvis. And not only that, but the hormonal changes that happen throughout pregnancy and during labor. So a high incidence of this problem happens to a lot of women that have just delivered, in the past 6 months or so. And again, the pain is global, maybe anterior thigh, maybe lateral thigh. They'll be able to pinpoint it back here. And most, if not always, it's the right pelvis that's rotated, anteriorly. And there's not enough research as to why it is the right pelvis, but we have figured out that it's mostly always the right side. But in any sense, it's causing an extra stress and torsion on this segment here that will then, either impinge that nerve root at that segment or just is causing an instability here because it's shifting one way higher than the other, so it's now causing a stenosis or maybe even a herniated disc because of an SI problem. So SI joint dysfunction is the third common cause. Now, some of you might say, well, can I have an SI dysfunction and a herniated disc? Yes, it's very possible. But as soon as we take care and treat the SI dysfunction, the herniated disc will sometimes relieve itself. So in conclusion here, I'm just going to wrap up what we talked about. So number one, common cause of low back pain or sciatica is a herniated disc. Okay, number two is arthritis. Degenerative disc disease and stenosis. And number three is SI joint dysfunction. So there you have it, everyone. The three most common causes of low back pain and sciatica: herniated disc, arthritis, degenerative joint disease, stenosis, and SI joint dysfunction. Herniated disc, pain will increase with forward bending, but it may decrease with backward bending. Arthritis, degenerative disc disease, and stenosis is the complete opposite. Pain will increase with extension. Pain will decrease with flexion. And SI joint dysfunction, you may have pain when you stand on one leg, pain going up and down stairs, pain with long periods of sitting. Again, arthritis, degenerative disc disease, and stenosis, you'll have relief of pain with sitting. Herniated disc will increase your pain with sitting. And the opposite, pain will increase with walking, and over here it'll decrease with walking. So again, just to recap what we've talked about, three common causes of low back pain or sciatica: one, herniated disc; two, arthritis, degenerative disc disease, or stenosis; and three, an SI joint dysfunction. Now, if you or anybody you know is suffering from any one of these conditions and you want to know how to naturally heal yourself without injections, medications, or surgery, I want you to do one simple thing. I want you to email me at my personal email at frank@pure-physicaltherapy.com. And in the subject field, I want you to jot down one of these conditions that you think you may have. And in the body of the email, I want you to tell me why you think that is. Okay, so for example, if I were to do it, I would put in the subject line herniated disc, and then in the body, something about why I think, I have a herniated disc. Either, tell me a little bit about your story, maybe you were lifting something, or you were doing some repetitive bending, how long ago it was, so that I can know a little bit about your history there to better give you some advice. And then again, please include your name and your physical address and a telephone number as well. What I'm going to do for those of you that email me, I'm going to send you back a report, a written report with all this information that we went over, titled The 3 Common Causes of sciatica or back pain. And I'm also going to throw in there a report on the 10 most burning questions to sciatica. These are questions that patients routinely ask us, and we've put them together in a paper format with their answers, so that you could better educate yourself on any of these topics up here and help you manage your back pain a little better. So again, please send me an email at frank@pure-physicaltherapy.com. In the subject, I want you to write one of these 3 conditions that you think you may have, and in the body, go ahead and tell me why you think that is. Thank you. Hope to hear from you soon, and have a great day.